Behind this door is the red zone, the very front line of Paelon Memorial Hospital's COVID-19 battleground. Immediately, we find casualties, all of them positive with coronavirus in the thick of its second wave to hit Nigeria. We're brought into a room where a patient has summed up enough strength to sit up in his bed. He's an American pilot who was infected during a flight over the festive period.
I've been here, I guess, 3 or 4 days, and I don't know, sometimes I feel improvement, sometimes I don't. Well, I can hardly breathe, so my chest was full. Well, my symptoms started probably on the 24th or 25th of December, and I'm part of a flight crew, so the whole flight crew, the flight attendant got sick, and she thought she had a cold, and so then the co-pilot got sick. He thought he had a cold. So the 26th, we got a little worse, so we went and got tested. And today's a good day. Today's a good day. Well, you know, I don't fear COVID, but it is a bad deal.
We've spoken to the gentleman, and though he is in high spirits, the gravity of the situation is undeniable. He has been at the facility for the past 3 to 4 days, and though he says today is a good day in terms of his symptoms, he has most certainly had more difficult ones. And though he is optimistic for the future, it is a very serious situation on the ground. We have, as I've just said, spoken to a patient, and we're hoping to speak to medical professionals to get their insight on their work at this very trying time.
So when we started in June, it was still new, and we managed our way through it, seeing patients and having success rates and all, and everything went down. The second wave has been like a chaos, because it started, we had a peak in November, people coming in, no bed space. We've converted so many places that shouldn't have been converted to wards. So the situation right now, it's a bit alarming. We, the health workers who are working in here, can understand, but we need to relate to others that this is the situation on ground.
This facility is meant to hold 11 patients. At the time of our arrival, there were 14. And with a car with another COVID-positive patient arriving downstairs, there's no sign of this wave subsiding anytime soon.
First of all, it's very annoying going out there to hear people who say COVID-19 is a scam, hear people say it's not real, we don't have it. It's very annoying with what we are facing here. So what I have to tell to Lagosians, what I have to tell Nigerians is that COVID-19 is real, and the second wave of COVID-19 is much worse than the first wave.
Despite the growing number of COVID-19 infections in Nigeria, the number of recoveries has far outweighed the number of deaths. But one look at this patient struggling to breathe in intensive care is enough to sow a seed of skepticism in even the most devout believer. As the sound of painful coughs fill the corridor, one can't help but hear 3 words of warning ring out to those still doubting the danger of this virus. This isn't over. Adefemi Akinsanya, Arise News, Lagos.